pumunta dito. So, we'd like to thank our media partners and endorsers for coming to our media launch today. We at Svelt'i are excited to introduce the innovative thulium surfacing laser that we call Lavien. So, most of the skin problems that we encounter here at our centers, here in Timog and sa Ortigas, are those people with deep acne marks, melasma, dark pigmentations, and possibly, this is caused possibly by the hormones or the suns. Lavien deals with those skin problems. So what's even more exciting is Svelt'i is the first clinic here in the Philippines to offer this treatment. So let's please stick with us, and Doc Owen will tell you more about the Lavien treatment.
Let's give it up for Miss Joy! I'm a Svelt'i baby, ladies and gentlemen. I came here just this last November. My confidence was very, very low, especially for somebody who does a lot of events. I found myself at 40 something. I'm 45 this year. Sige, wag na po tayo maglokohan. I couldn't imagine na sa edad ko po magbe-breakout ako ng bongga. Like I was 15 years old. So my goal is far from having like super clear skin, but because of Lavien and my Svelt'i family, it's getting there slowly but surely. Ayan po, ito po ang effect ng Lavien. I'm on my second session, and I can't wait to share with everybody what Lavien is all about. Okay, so again, let's reiterate the fact that Svelt'i is it's the first health and beauty clinic to be offering this treatment. Now, taking control also means being willing to undergo a transformation, a rebirth of some sort. Now, this time though, we're talking about skin rebirth. And I'm sure you guys are excited. So, to make us know more about this newest technology we call Lavien, that does skin rejuvenation and other treatments, let's watch the AVP. Everyone. Welcome on stage the person who can further discuss the benefits of Lavien, how it works, and how one can achieve a total skin rebirth with this new technology. She is a diplomate and a current board officer of the Philippine Academy of Primary Skin Health Physician, a fellow of cosmetic surgery and current board officer at the Philippine Academy of Aesthetic Surgery, and an associate fellow in Philippine Academy of Aesthetic and Age Management Medicine. Our very own medical director, let's make some noise for Dr. Maria Rowena Owen Aguilar from Ven. Hello, how are you today? Hindi colorblind si Doc Owen, talaga naka-teal blue. Ito na yung closest blue ko sa bahay. Okay, Doc, take it away.
Oh, thank you for that introduction, Miss Tina. And before I start, okay, let me share you something. For the past years in my consultation for the surgical and non-surgical patient, there's a thing that the patient usually asks. Aside from the pain that they think of as tiis ganda, there are two more questions that stands out. Like, Doc, how long is the healing period? And at the same time, Doc, if there's a downtime, what are those? Alam nyo, to be honest, revealing and answering those questions might break or make my pocket. Kasi sometimes, they ought not to do it, natatakot. Okay? But then, finally, I'm so happy to meet Lavien, because this is the first BB laser that we have. And, again, I'm Doc Owen. I'm Doc Owen, and I'm going to tell you more about Lavien and how it changes the gateway here is my agenda for today, and for all we know, Lavienne came from a phrase from Lavienne Rose, or directly means that it is a life in pink. Or what we say, something like in the English saying that to see something in a rose-colored glasses. Okay, it simply means to see life. But here in Svelt'i, we usually associate it with a clear and pure skin. Okay, so let me first introduce to you so that may idea tayo. For this cosmetic industry, we have two types of laser. We have the ablative type and the non-ablative type. So, this is the, sorry, oh, hindi siya magana. That's okay. So, the ablative type is it works by delivering an intense wavelength of light which removes the outer layer of the aged or sun-damaged skin. Whereas the non-ablative type, those that works by heating up the underlying skin tissue, take note, without harming the outer layer of the cells, but produces a collagen, or what we call collagenesis. And this Lavienne is made up of 1927 nanometer thulium laser. It is a new wavelength. Take note, a novel one, like the novel that we have now. And it is a new wavelength, more effectively targeting those pigment lesions or those photo damage skin areas, such as like the melasmas, and usually it is usually seen on the first treatment. Okay, so given that we have the thulium laser, and with that kind of laser, Lavienne becomes a new player in the laser world and introduces us to its what we call sub-ablative mode. Okay? So kanina, we only have ablative and the non-ablative, right? So ngayon, eto na. We have the sub-ablative mode. Okay, para maintindihan natin ang lahat. Okay, please focus yourself on the red box. Okay, on the red box, that's the thulium which has a 1927 nanometer, and it gives us the sub-ablative mode. Okay, let's see. It targets the junction between the epidermis and the dermis. So, it leaves the outermost skin layer intact. As you have seen, it leaves the outermost layer intact while it modifies the skin below it. Okay? And with that unique subtype of laser or ablative type of sub-ablative type of laser, it is also effective in improving our skin elasticity. Also for reducing those enlarged pores, at the same time, those fine wrinkles that we have. Okay? And this will give you the result tantamount to having a permanent layer of BB cream on the face. Hence, it is widely called to us as the BB laser. Okay? So see, with that a single rejuvenation or single procedure, you will have a mattified face. Okay? But, okay, to further discuss it, we have to compare it with the existing laser machines that we have in the country, right? So, comparing it with the non-ablative type, see, they both have the same target. Okay? Sorry ha, pwede ba ako lumapit? I'm sorry. They both have the same target, but take note, there's no harm or there's no breakage in the outer surface. But, again, with the function of non-ablative as mainly for rejuvenation, given that kind of denaturation or tissue reaction, see, mas maganda at mas effective, and at the same time, simultaneous niya pinapaganda ang tissue beneath it. So, comparing it again with the non-ablative, it is with the same target area, with the same property that it doesn't harm the outer surface, but it has more energy, more capacity for treatment. You get that? Sorry ha, Again, dito naman ako sa kabila. Okay. Sub-ablative mode. Comparing it again to the ablative mode. Okay. They have the same area of target. Okay. And they have also the same treatment functions such as what? Yung kanina sinabi ko, for those unwanted pigments, fine wrinkles, mga enlarged pores. So, they have the same function. But take note, the ablative one surely breaks the outer layer. So, tinatamaan niya. Kasi, it needs to break down those outer layer to be able to reach and coagulates the tissue beneath it. Unlike with the sub-ablative mode, wala. Same function, again, same function, but look, no breakage. What does it mean? It only means that it has a lesser downtime. Lesser healing time. So hindi natatakot ang mga patient natin na, oh no, after 5 or 7 days pa talaga ako maghuhunos or magtutuklap. I'm sure those of you who had fractional laser experience that. Okay? So again, to recap, for that sub-ablative, comparing it with the non-ablative, for the rejuvenation, that's the main function, right? For the rejuvenation, it has the same paramount of safetyness, no breakage on the outer surface, but more effective in treatment. Kumbaga, may treatment ka na, may rejuvenation ka pa. Okay? Comparing it with the sub-ablative mode, comparing it with the ablative mode, the same treatment that we can have with that ablative, but with a lesser downtime. Okay, that's the wonder of Levienne. Okay? See, this is a clinical trial on how tissue reacts according to the energy intensity. So look on the first picture on your right, on my rightmost side. Okay, that's the effect of a non-ablative one. See, on the circled one, minute lang yung denaturation effect. But this one, using the ablative type or the treatment function of Levienne, see, it goes to the same spot but with a larger area of treatment. Tapos, meron talagang denaturation and coagulation na nag-e-effect, which in turns, again, produces more collagenesis. Okay? And comparing it with the ablative one, see, sira na. Hindi mo na ma-identify yung layer ng tissue na yun. So, that's how wonderful it is. Okay, and now, for its indication, again, sabi ko nga, Levienne can function either in non-ablative mode, such as for the skin rejuvenation, and also Levienne can also function in an ablative mode, which is for the pigmentary treatment and dermal remodeling. Okay, those are the problems. Who among you have this kind of problem? Meron at meron tayo, di ba? Paisa-isa. Minsan, age spots, magpunta, ano ito, maitim na to? Akala nyo, pimple marks, di ba? May mga ganyan. Chicken pox, ang dami natin mga cases na ganyan. Okay? So, yan ang mga natitreat ng ating amazing machine. Okay? For the principle of treatment, if we could still see a scattered melanin pigment, the black one on the first circle, okay? So that's a scattered or unwanted pigment. And then when the machine will emit its finely divided laser beam, the second circle. So this is it is where we target the unwanted pigments. At the same time, without harming the outer layer, and of course, while doing nothing on the outer layer of the skin, we do some ablating function beneath it. So, gumaganda na siya sa loob. Okay? And the last circle, you can see that there's a fine scab or microcrust. Take note. fine scab and microcrust. Actually, kung makikita niyan, parang nagtuldok lang kayo ng napakaliit na tipong 0.5 yung sa mga ballpen natin, ganun lang siya kaliit. So, as it drops naturally, we can say that the pigment is then cured, but again, it's like buy one, take three to it. The pigment is cured. At the same time, there's an improvement in skin elasticity. And again, yung mga enlarged pores na reduce. Also, yung sa mga fine wrinkles na wala din. So, it's like buy one, take three ang ano natin, Kilovian. Okay? The result of treatments. Ito na. This is some of the things that I usually discuss with my patient. Ayan yung tinatanong to. Ano na yan? Paano mga downtime? What are those? So, here it is. On the day of treatment, take note ha, I will be discussing here on the treatment side. Kumbaga, nasa ablative side tayo. So, more on the ablative side. So, on the day of treatment, there's a slight swelling. Okay, there's a slight swelling, and it depends on the individual differences depending on the intensity of treatment. We usually do 2 passes, okay, in a crisscross manner. So, as you have seen, we miss our mom nurse here, Ma'am MJ. So, he's doing the vertical procedure, and actually, ano yan by area. So, ganyan ang ginagawa. Actually, sa tingin ko, pwede natin tanungin itong si Sir Jerome. Sir Jerome, how does it feel? O, diba, simultaneous tayo? Kasi si Lovien is simultaneous, right? So, you have to do it. Makikisabay tayo kay Lovien. Sir Jerome, how does it feel? O, habang ginagawa ka dyan?
Medyo mainit siya, pero tolerable yung ano niya, yung kirot or yung init.
Okay, thank you. Tapos, yung mga area natin, we usually do it in, kumaga sabi ko nga, per area. So, our nurse now is doing the cheek area. Later, siguro, pwede dyan sa, dito sa ating forehead. Oh, by the way, may I ask, nagpalagay ka po ba ng topical anesthesia, Sir Jerome?
Wala po.
Ako rin gano'n, hindi rin ako nagpalagay. But, on my case, I asked them na medyo babaan ng konti kasi you will feel the heat inside it. Okay, you will feel the heat. And then, usually, pagdating sa mga bony area, sometimes, nararamdaman ko na yung init na parang tumatagos na dun sa aking kabutuhan. Hindi sa kaibuturan, sa kabutuhan. Okay, pero tolerable. That's the good thing of it. It's tolerable. But again, it depends on the pain threshold of the patient itself. And we do not encourage na lalo na sa mga first-timer to do it without an anesthesia kasi mas comfortable sila, mas marerelax sila, and at the same time, babalik sila, right? Oh, how are you, Sir Jerome? Wala siyang magawa. Okay naman po doon. Oh, dami niya ng pictures. Okay. Tutuloy-tuloy na yan ni Miss MJ hanggang mamaya. Actually, tatapusin ni Miss MJ yung
Sa treatment room na yan.
Yeah, tatapusin niya yung Yes, actually, kalahati lang.
Kalahati lang po.
Kalahati
Next week po yung kalahati.
Oo, nagkakanta sa amin si Jerome kanina. Oo. So, we will be finishing the first half of the face para maipakita rin sa inyo mamaya, my percent. And, okay, to cap my talk here, reasons why Lovien is good. Is it because curing the intractable pigment which cannot be improved through several times of laser toning or IPM? At the same time, it has a brightening effect on the whole face. Tapos, ito pa, may brightening effect ka na, natanggal pa ang pigment mo, meron ka pang improvement sa hair follicles. At the same time, yung mga wrinkles mo, fine wrinkles, nababawasan. And most of all, yung skin elasticity natin, which we all know na kailangan natin para sa ating maganda and youthful skin. Okay, kung walang elasticity, it will go down. Okay? Tapos, ito, pinakamaganda. Lesser downtime compared to general fractional laser. Almost to no side effect as a non-peeling laser. Saan ka na nakakita? Naka-fractional ang function mo, ang effect mo, but non-peeling effect, di ba? With no downtime, hindi ka nagtutuklap ng sobrang tuklap na tuklap. And it has a perfect effect with one-time treatment as rejuvenation and as treatment. Have a nice day. Again, I'm Doc Owen. It gives an intensity at the same time, it has an heat on it. So parang it is also good for those MPS or what we call the myofascial syndrome. Yung mga dinudurog ng PT, yung mga bilog-bilog na sabi nila, in layman's term is lamig. Yeah. Yun. Isa rin yun sa tinatanggal ni lumbago. Okay? And for the second one, we also have a Cellushake. Okay? That machine, of course, ang target natin dyan is the cellulites. Okay? So,
Taas po ang kamay na may mga cellulite.
Una-una
Diba?
na ako. Oo, kahit yata anong gawin ko, hirap ako eh. But still, andito na ako. So, I'm trying it. So, ito, this is good for cellulite. And, sabi lang, what about for those who doesn't have a cellulite? Well, it is also good for contouring. Kasi sometimes, di ba, kahit kapitit, minsan wala kang makikitang gap in between your legs. Kasi
hello,
we are
ako po
born
yan.
with it. Kasi sometimes we are born with it, di ba? Parang so, ayun, we can do contouring for that. And lastly, for a Hollywood Vital Facial. So, ito, anong difference yan? Pare-pareho ng facial yan, do. But here, with this type of facial, umpisa pa lang, for the cleansing pa lang, we have yung mga tinatawag natin na fruit base. Lahat sila more on organic. At saka, it is, this facial is more on for anti-aging. At the same time, it's for skin detoxification. So, yun siya. Hanggang matapos yung procedure, ultimong serum, may mga omega-3 fatty acids. So, kompleto siya. Kompleto, ricados.
Palakpakan po natin si Doc. Thank you, and Miss Cora, and Miss Mama Arlene for sharing your experience. Ngayon, again, Doc, ito po let's just do a repeat. Ang ating mga specials. So have the confidence to show some skin and get rid of those cellulites with Cellushake. Feel like a real star with a Hollywood Vital Facial and enjoy ultimate relief from back pains with lumbago. I can't wait to try lumbago. Siguro po habang kumakain kayo maglulumbago. Okay, so don't forget to check out those specials here at Svelt'i. Now, since you're all are here,